My name's Mike Tunstall. I'm from Liverpool. I'm 43 years of age, and I'm here to tell you about my kidney cancer journey, which began in 2009 at the age of 36. My symptoms were very minor. There was just a dragging pain in one of my testicles, which went on for a few months, so I thought I'd just go to my GP to get him to check it out. He didn't think it was anything serious, but he thought we'd best have an ultrasound scan just to check. That then followed probably about 6 weeks later on a Saturday morning at University Hospital Aintree. They told me just to expect the results back off my GP in a few weeks' time. However, on the Monday morning, I received a call from the hospital asking me to go in on the Thursday for a CT scan. I think it was at that point I knew something was obviously wrong. The hospital staff couldn't give me any more information. So after having the scan, possibly in another week's time, I was in hospital and being told I had a tumour on my left kidney that was 9 by 4 centimetres in size. This was obviously a huge shock to me, devastating news for anybody to receive, especially at the age of 36. The staff were brilliant. There was dedicated nurses on hand to speak to me and give me support and information and contacts for other people to speak to. A couple of months later, I was scheduled in for surgery where I had a laparoscopic nephrectomy to remove the whole kidney and the tumour. This was all the treatment I needed. The scans confirmed that the tumour was confined to the kidney and it hadn't gone anywhere else, which was good news. With the laparoscopic nephrectomy, I was in hospital about 4 days. I was quite sore afterwards, and unfortunately as well I got an infection at the site of the surgery, so I was readmitted to hospital for a further week where I had a drain fitted and was given some antibiotics to cure the infection. That all went quite well, and within a week to 2 weeks I was back to more or less full fitness. Referred back to my urologist, Mr. Baird, at Aintree. I was given CT scans every 6 months for the first 2 years. Everything was fine on that. No new cell growth, no sign of any spread to any other nearby organs. At this point my scans went annual, and then after that they went to ultrasound, because the ultrasound scans carry no radiation, whereas the CT scans do have a high level of radiation. So I was on my 7-year follow-up. I had the usual ultrasound and chest x-ray as well. Chest x-ray was perfectly fine. The ultrasound revealed a very small tumour on the right kidney. Mr. Baird did emphasise it wasn't completely clear and I'd need a CT scan. Sadly, the CT scan did reveal that it was a tumour. So he basically said that my case would be referred to an MDT, which is a multidisciplinary team, which will consist of a number of specialists. So there'll be urologists, radiologists, oncologists, and they'll basically all discuss my case to look at what's the most suitable treatment. Following this, I was then referred to the Royal Liverpool University Hospital to see Mr. Weston, consultant urologist at the Royal Liverpool University Hospital. There was different treatments which we discussed. First one was to do a partial robotic nephrectomy, which would involve, with the assistance of a robot, keyhole surgery to remove the tumour, but to leave the rest of the kidney intact. but there was a very small risk that I would actually lose the kidney if things didn't go to plan, which would obviously be catastrophic. The other option was just to leave it alone and just survey it over the next 6 to 12 months just to see if it did grow, and then to see whether any action at that point would be required. The taking of a biopsy was also discussed, but the results of that, the consultant said, may not be that accurate. A couple of other treatments we talked about were ablation, one with heat, so there's a radio frequency ablation, and a cryoablation, which destroys the cells with very cold needles. So I went away after this meeting to have a think about my options. I went on the internet and had a look around just to see exactly what these treatments were, whether they were available locally, basically to see who was the best person to do this procedure for me. So after a period of time, I found information on Kidney Cancer UK of a Dr. David Breen, who practices in Southampton. His specialist field is interventional radiology, so I had to read up on him and what he specialises in for very small renal masses is cryoablation, where he'll put a few needles in and they'll actually surround the kidney tumour and freeze it so it will actually kill it. There's no need for a big incision. You only stay in hospital overnight and you're back to normal activities quite quickly. So as soon as I met Mr. Breen and we got talking, I thought, this is the guy I want to do this procedure on me. He's internationally renowned in his field. He explained everything in detail. He's able to tell me exactly how many procedures he's done to date and the fact that there's a very, very low complication rate. So I basically said, yeah, let's get this done and let's get rid of this cancer once and for all. It was probably within another month he did the operation. I went into Southampton on a Thursday evening. Friday morning I got the procedure done. He came and saw me Friday night and said he's very pleased with it, and he'll come and see me the next day. I was discharged the next day and went for a follow-up. 3 weeks later I had a CT scan again down at Southampton, and he was very pleased with the outcome. The images were exactly what he wanted to see. Dr. Breen discharged me. I'm now back under Mr. Baird for future surveillance, hopefully by MRI scans annually, until such time as we feel I can be discharged. And the reason for me doing this video is basically to raise awareness of this treatment and kidney cancer in general. Thank you for taking the time to watch this video.